Are you or someone you know wanting to have a little bundle of joy to add to your family? If you are, you need to know about a serious condition only related to pregnant women called preeclampsia. I was diagnosed with preeclampsia at 24 weeks during my pregnancy with my son. It was a scary situation for my family and me, but we caught this disease early enough and were able to come home with a beautiful baby boy 4 months later. Today I will tell you the causes of preeclampsia, the symptoms to look out for during your pregnancy, and the treatment that is required if diagnosed. Let's get started by taking a look at the causes of preeclampsia. According to mayoclinic.org, preeclampsia is rare. About 3 to 5% of women are affected. The exact cause is unknown, but many scientists say that the following are contributing factors. In the first stages of pregnancy, new blood vessels are developed to send blood to the placenta. In women with preeclampsia, these blood vessels don't develop normally. This symptoms amount of blood that is transferred to the placenta. High blood pressure is another contributing factor that affects and can damage the placenta. Along with this risk factor, preeclampsia can cause there to be limited blood flow from you to the placenta. This can cause the placenta to become damaged or misshaped. This could also cause an abruption of the placenta in which the placenta detaches from the uterus wall, causing severe bleeding. This puts not only your baby at risk, but yourself as well. Most women that develop preeclampsia tend to be obese. Most obese women have a much higher blood pressure than a woman of normal weight. Blood pressure is one of the main factors of preeclampsia. Obese women have a different body composition than a woman with an average weight. This difference in total body fat can put stress on your placenta, increasing the risk of damaging it. Like I said before, the exact cause of preeclampsia is unknown, but we can help prevent this disease by becoming aware of the studies experts have done. So you now know what contributing factors preeclampsia consists of. Let's take a look at what symptoms are involved when diagnosed with this disease. The symptoms of preeclampsia are very serious and require medical attention. One of the main symptoms of preeclampsia is high blood pressure. Any blood pressure over 140 over 90 is considered abnormal and should be brought to your doctor's attention. This needs to be documented twice, at least 4 hours apart, to be contributing evidence in a high blood pressure. Another main symptom is having protein in your urine. This is called proteinuria. This can also be related to other kidney problems. Sudden weight gain and or swelling also accompany preeclampsia. Swelling includes a term called pitting, which is called edema. The swelling is usually of the hands and face, but can also affect other parts of the body. You know you have edema when after pressure is applied to a small area, the indentation persists after the release of pressure. It is very difficult to determine if the symptoms you are having are related to preeclampsia. Many of the symptoms are the same of a normal pregnancy. You should see a doctor if you believe that you are having any of these symptoms and think that they are resulting from this specific disease. Or see a doctor if you have increased difficulties in breathing or any abdominal pain. This is usually a sign of preeclampsia and requires medical attention. I'm sure you are wondering what can be done about this serious condition. The treatment is keeping the woman and child stable as long as possible because there is no cure. If the pregnancy is 37 weeks or further along, the doctor will usually deliver the baby to stop any other problems that may arise. The doctor will try to stabilize the blood pressure of the woman by placing her on a magnesium drip IV along with blood pressure medication. The doctor will provide steroid shots that the baby can develop at a rapid rate in case of an emergent situation, such as an emergency C-section. Ultrasounds are also necessary in this type of situation. They show the level of fluid in the placenta. If it shows a rapid decrease in the fluid or if it's causing the baby any risk at all, they will have to decide what the next step would be to take, deciding whether the greater risk would be to give the baby a chance to grow and receive more nutrients or to induce labor. Preeclampsia is definitely not a condition to take lightly. If you're pregnant, remember to take care of yourself during your pregnancy. If you know of someone who is pregnant, they need to be cautious as well. Any precautions you can take to prevent this disease will make you and your upcoming baby healthy. If you can relate to any of these symptoms, remember to take action because it is a disease that requires medical attention. Preeclampsia is dangerous to both the mother and baby. Many of us do not expect this condition could happen to us, but we are not invincible or not immortal. Anything can happen to us at any given point in time. Pregnant women should be prepared for this serious condition so they can make the best of the situation. I got my information from mayoclinic.org and www.preeclampsia.org. During preeclampsia, this is the blood vessel. That is a normal blood vessel. You experience high blood pressure, nausea and vomiting, vision problems, seizure, neck pain, shoulder pain, vomiting, bleeding, fatigue, swelling, pitting. This is a normal placenta in a pregnancy, and this is a placenta abruption during preeclampsia. Here's another picture of swelling or pitting. As you can see, the pitting is shown after she takes her shoes off. You need to take your blood pressure regularly if you are experiencing preeclampsia during your pregnancy. The doctor will put you on steroid medications, blood pressure medications, and magnesium IV drip to stabilize the blood pressure. And this is a baby born early due to preeclampsia, and then this is the baby born in a normal pregnancy.